Welcome back. As medical practitioners, doctors play a crucial role in providing healthcare services to patients, including counseling on contraceptives. Understanding the pros and cons of different contraceptive methods is essential for guiding patients in making informed decisions about their reproductive health. In this interview, we will explore the benefits and drawbacks of various contraceptives from a medical perspective with Dr. Soraya de Almeida Chisea. Dr. Chisea, good evening and welcome to the show.
Good evening, Ina. Thank you for having me.
Thank you for joining us. Doctor, to start with, can you explain the importance of contraceptives in family planning and reproductive health?
The importance of family planning, there's a vast role in it, but let me rather focus more on the mental aspect of it. So first of all, if we just have to focus on the now, like the economic status right now, there's a high risk of unemployment in our country. So having an unplanned child affects not only the parent or the parents, but the child's quality of life as well. Another one is a psychological factor. Imagine a stressed parent that is obviously not going to be physically, emotionally, psychologically, and financially present for the child. So you can just imagine the effect that has already just on the individual themselves, and then now having to bring an unplanned child into this world. Another factor also is that pregnancy on its own is actually a risk, because many people actually tend to, not many people, but there is a certain percentage of women that do not make it with the delivery.
Right.
So either the baby's life is lost or the mother's life is lost, or both of their lives are lost, and that's actually a massive risk. So a woman that is properly planning for having a child or children needs to be psychologically prepared, needs to be mentally prepared, needs to be financially prepared, and even just a partner as well. And that alone is important to actually have a proper planning regarding the number of children that you want, and also to make sure that your body is actually ready and prepared to actually undergo the childbirth process, whether it's going to be natural vaginal delivery or if it's going to be cesarean section. So it's really important, and it affects all aspects of our life, not only you as an individual, but also the life of this innocent child that you're bringing in this world that you have not prepared for. And there's so many other consequences that this child also ends up having moving forward for someone that was not planned at all.
Doctor, talk to us about the different types of contraceptives that are available and how they work to prevent pregnancy.
Well, there are different types. So if I just have to classify them, I'll classify them under 3 different types of contraceptives. So we have the hormonal ones, which is now the common one that we have, which is the pill. We have also the IUD, the hormonal one. We have the implant. We have the injectables. We also have the patch. That's under the hormonal contraceptives.
Right.
And then the other classification is what we call the non-hormonal contraceptives. So we have the copper IUD, which stays in your body for up to 10 years. We also have the withdrawal method. Some people swear that they've been doing it for years and they've never had a child. Others, unfortunately, the first trial and then there comes a baby. Another non-hormonal form of contraceptive is old school abstinence. And then the last one is now what we call sterilization, where the woman's tubes are either tied or the man gets a vasectomy. And then the third classification is what we call the barrier method. So we can have now the condom or the femidom, the spermicide gel, and then the diaphragm, the sponges, and so forth.
Right.
So yeah, those are the different types. So in a nutshell, contraceptives are there to prevent ovulation. They're there to, what they do is thicken the cervical mucosa. Basically, the cervix gets thickened, and this now impedes the egg to actually go through into the uterus to fertilize the egg, the sperm, prevents the sperm going into the uterus to fertilize an egg. And then also, for example, with the copper IUD, what it does also is because it has copper, so the copper in itself actually kills the sperm as well. So this is how this methods prevent pregnancy.
Talk to us about the advantages of using hormonal contraceptives, such as the birth control pills you mentioned or the hormonal IUDs.
So the advantages aside now, obviously, no, not just preventing pregnancy. For example, when we talk about the pill, right, the contraceptive pill, people that suffer from acne, they actually have an advantage of being on the pill because the pill actually helps them with their acne problems. People that have irregular menstrual periods or menstrual cramps, they also benefit from being on a hormonal contraceptive. And then another benefit also is, for example, with the implant and even also the contraceptive people that have bleeding problems, for example, especially with their menses, heavy bleeding. There are certain types of contraceptives that actually help minimize the bleeding as well, and also just your regularity of your menstrual cycle. So if someone has irregular menses, they don't get to know when they're ovulating and so forth. So the pill actually does help them, and even the patch as well, because when you use it, you'll know exactly which time within your cycle will you be able to actually now then be ovulating, or when you actually go on your period. So those are one of the benefits of actually being on a contraceptive for the hormonal part, which is now the acne, and now also irregularity of your menses.
As much as there are benefits, there's also side effects or risks associated with hormonal contraceptives. How do patients manage these?
So ideally, basically with contraceptives, it's never one size fits all. You'd find certain women, the first time they go, for example, on a pill, it works for them for many years and they never have issues. But for some, unfortunately, the first time that you go on one, it will probably give them side effects. Now, with us, with the medical profession, you always have to assess your patient properly, a proper history. Taking regarding also medical condition. If you already have pre-existing medical conditions, for example, if you're already known hypertensive, or if there's a strong family history from both parents where there's high blood pressure, you wouldn't want to give this person a combined contraceptive pill, for example, because it also has one of those risks where you can actually end up having high blood pressure. For someone that, for example, also has clotting problems, blood problems, you wouldn't want to put them on certain contraceptives as well. For someone that also has a family of breast cancer or cysts, you also wouldn't want to put them on certain contraceptives with that have such side effects. So ideally, a proper history, a proper screening. If you are someone that's already on the bigger side and you've already been struggling with your weight, you ideally wouldn't want to be on a hormonal contraceptive, right? So it's basically getting to know the patient profile, getting to know your family history, and also what your needs are, what it is that you want to get from this. It will also depend on, obviously, the type of contraceptive that you're going to give, whether it's going to be one that lasts for years, or are you going to give one that's just short-term? Maybe the person just wants to be studying and then don't want to have any oops moments. So it's important to take a proper history and also understanding your patient. And should side effects obviously come about, you'd want to go to your doctor and make sure that you obviously try something else until you find the perfect fit. And unfortunately, there are cases where people will try and literally try all different types of contraceptives and none will work for them. So the only way is possibly maybe just in a barrier method or, abstinence.
You mentioned under your third classification of contraceptives, barrier methods such as condoms. How effective are condoms in preventing pregnancy and sexually transmitted infections?
Contraceptives in general, there's not one contraceptive that is 100%. So there's always those ones that have, in the 90s, at least in the late 90s, 97, 98, but 99 to 100% never, except for obviously if you're abstaining. But condoms in generally are effective, but we just have to put in mind that it has to be put on properly. You also, in terms also of during the intercourse, there are moments where the condom can burst or it can tear, and obviously you're gonna that obviously now the sperm sips out of that and enters into the female vagina and into the reproductive system, then you can also you can end up falling pregnant. So it's not 100%. None of them are 100%. However, it's important that should you have an oopsie moment, should you find out that maybe the condom burst or it slipped off, it's always important to at least have an emergency contraceptive right after that to avoid any unplanned pregnancies. But let's also just be careful that it's not just about unplanned pregnancies, but even sexually transmitted diseases. It's not just about the sexual intercourse where the penis enters the vagina, but even oral sex as well. So oral sex, even though there's obviously you can't use a condom with oral sex or whatever, but people also need to be cognizant that it's not just the sexual act or the penetration that prevents the diseases. You can actually also have HIV. You can actually get an STD like gonorrhea or syphilis with oral sex as well. So it's important to check yourself as partners before you engage in such activities.
I want to talk about the benefits and drawbacks of long-acting reversible contraceptives such as, IUDs and implants.
So the benefits, long-acting, it basically means that they can stay in your body for a long time. For example, with the implant, you can have an implant for up to 3 years. And with the IUDs, you can have 3 to 5 years to 6 years and even up to 10 years with a copper IUD. So the advantage that this type of contraceptives have, aside the fact that they can stay in your body for a long time, if you really don't plan on having any children for a while, but the reason why they are the other advantage is that they're reversible, meaning that at any given moment, should they be removed, should the implant be removed from your body or should the IUD be removed from your body, you can conceive, usually your cycle continues as normal, like there's no change, unlike other contraceptives where, for example, if you're on the injectable, some people actually even don't get their periods at all, where sometimes they have to wait for up to a year for their body to actually go back to its norm in order for them to be able to conceive. So the advantages is that as soon as they're removed from your body and you want to conceive, you can literally have a baby within the next cycle, if not thereafter. So those are the advantages of the long-acting reversible contraceptives.
Fantastic. Just lastly, Doctor, before we let you go, just to discuss the impact that contraceptives has on menstrual cycles and the overall reproductive health. It has its benefits. So the benefits, again, like I said, mentioned earlier with regards, especially with the contraceptive pill, for someone that is having already irregular menses, you would benefit if you're going to be on the pill because it actually regulates your menstruation. So you get to keep track of your cycle, where you know at least within this time, or as soon as I'm done with the first few sets of pills, when I take the placebo ones, I'm definitely going to ovulate. I'm definitely going to go on my period, for example, or with a patch as well. Because with a patch, you get only 3 patches in a month. So the first 3 weeks, you put the patch on, and then the last week when you take it off, that's actually your bleeding time. So that's the benefit of certain contraceptives regarding your menstrual cycle. However, the other types, for example, the injectables and so forth, they have a disadvantage where you get some people where they don't get their period at all. Some actually have heavy bleeding. For example, with the copper IUD, despite the fact that it's non-hormonal, if you're already someone that already has a heavy menses, it's not advisable for you to go on the copper IUD, for example. So it has its benefits. It also has its disadvantages for someone that already has heavy menses. So yeah, it does affect it positively or negatively depending on what your situation is as an individual. Dr. Chisea, it was so informative having you with us this evening. Thank you so much for your time and joining us here on the Daily Roundup.
Thank you so much for having me, Nina.
That was Dr. Sireya de Almeida Chisea speaking to us about the pros and cons of contraceptives. We'll be